Good afternoon, Britain. It's 7 minutes past 1. Now, the evidence supporting gender treatments for children is remarkably weak. That's according to a major new review.
Yes, the CAS report recommends holistic and personal care for children over hormone treatments and puberty blockers.
Well, the Prime Minister has said that the findings show a need for extreme caution regarding children's gender care.
Of course, we must treat children who are questioning their gender with compassion and sensitivity, but we have to recognise that we need to move with extreme caution in these areas because we just simply don't know the long-term impacts of what this all means, and children's well-being is uppermost in our mind.
There's the Prime Minister's response. The paediatrician Dr Hilary Cass also added that the toxicity of gender culture wars meant professionals were afraid to openly discuss their views.
Well, the co-founder and CEO of Sex Matters, Maya Forstater, can join us now to go through this. Maya, I'm actually struck by the amount of consensus there appears to be with regard to this review. People who I would have ordinarily thought to be on either side of this debate, on either side of these arguments, are all saying this is an important and timely piece of work.
I think there's just no way of getting away from that conclusion. It's 400 pages. It's backed by peer-reviewed research, and it's absolutely clear that there is no good evidence for transitioning children. So it's very difficult for organisations to disagree with that. And so we've seen Stonewall and Mermaids, who for the past 6-8 years at least have been promoting giving puberty blockers and cross-sex hormones to children, changing their tune, and they're now saying they agree with this cautious approach. It wasn't what they were saying 6 months ago.
That's very interesting, isn't it, that some groups and activists appear to have changed their tune. Why do you suspect that is?
I think both the government and the opposition have welcomed this report. The weight of evidence is undeniable, and I think they've seen the way the wind is blowing. They have been promoting an unethical, unevidenced treatment to children and putting these clinics under pressure, and it can't go on.
Now, Dr Hilary Cass has been very careful in this review to strike a balanced approach, talking about how everyone should be treated with dignity and respect, how there should be screening, for example, for autism and for mental health issues for people that are going through the gender process, but also stopping short of saying that there's no such thing as a transgender child. In fact, it's saying that there may, in some cases, be people who are transgender under the age of 18.
I don't think she said quite that, Tom. It's not about children going through a gender process and being screened out for having other conditions. It's about looking at children holistically, not as gender patients, but as children who are distressed for some reason, and trying to work out why they're distressed and how that can be relieved. So the idea that this is about screening out other reasons so that children can get on the gender train is exactly what Cass is not saying.
No, Maya, I think we might be talking cross purposes here, because you're right, this is talking about a holistic approach, but it's not saying that transgender children don't exist.
It doesn't talk about transgender children. What it talks about is gender distressed children, and it says that clinicians have no way of knowing which of those gender distressed children might grow up and decide to be transsexual as adults. There's no way of knowing. And so they're not trans children, they're children who are experiencing distress. And the question is, should those children be given puberty blocking drugs that stop them growing up and stop them maturing sexually? And should they then be given cross-sex hormones which sterilize them? And the answer is very clearly no. So it doesn't make sense to talk about those children as being trans children. Hilary Cass is very clear. We should just think of those children as children.
Maya, are you hopeful that this will change the way the NHS and other gender services are operating in this country? We spoke earlier about how not all NHS services got involved with this review. They weren't willing to potentially share important evidence.
Yes, I'm very hopeful, and this will change what happens in England. And at the moment, children in Wales are also treated under the same regime. It doesn't change what happens in Scotland, and it doesn't directly change what private clinicians can do. But Dr. Hilary Cass did give a very clear warning to GPs not to enter into shared care arrangements with private prescribers who are acting outside of the NHS framework, and also to pharmacists that they shouldn't be filling private prescriptions unless they believe that it's in the child's best interest and it's safe. So although she wasn't able to directly stop private prescribers, I think she did everything that she could to try and reduce private prescriptions with families going outside of the NHS to these online prescribers, some of them not in the UK, who are still willing to give these drugs to children.
Again, this is about caution rather than absolutes. Well, Maya Forstater, thank you so much for joining us and talking through what is a landmark review.